Episode 220, the expert series with the owner and president of F2C Nutrition, Greg Cowan. Welcome to the pursuit of the perfect race. I'm Coach Terry Wilson, and with each episode, I bring stories of athletes to you that share their experiences at races in order for you to learn how to have your perfect race. You'll hear stories from athletes of all ages, abilities, and races of all distances. So regardless of where you fit in, there's something in it for you. Thanks for spending some time with me today. Now let the pursuit begin. Hey everybody, welcome back to the pursuit of the perfect race. Today I have the pleasure of talking with Greg Cowan from F2C Nutrition. If you've been following the podcast through last year, you probably made a mental note that nearly 50% of the athletes I've interviewed use F2C Nutrition. Because of this, I felt like I should reach out and get someone to explain why this is, and nowhere better to start than the owner of F2C Nutrition, Greg Cowan. So welcome to the show, Greg. I look forward to chatting with you today about your products.
Excellent. I appreciate that, Terry. I look forward to getting on the call and, talking about the things I love. Awesome.
Well, I look forward to this. So what made you get into the nutrition business to begin with?
It's the only thing I've ever really been in. It was a part-time job, back when I was, probably 12 or 13 years old. My best friend's parents owned a health food distribution company. So that was our after-school job. We would, repack organic eggs and label cheese and pack cereals and grains into bags. So it's kind of been, really my only job, and as I, kind of went through schooling and, kind of stayed involved, in the natural products industry and, looked at some other things. I was looking at actually a career in law enforcement and, turned out I had too many speeding tickets as a teenager. They didn't want me. So, I kind of went back to nutrition, which is what I knew, and, basically started, importing a brand of vitamins out of California, into Canada, selling it out of the back of my dad's minivan. I think I was 18 at the time. And, as I sold the products to the health food stores, got a little bit more money, I'd add more products and, basically, built a company that way. And, we continue to grow in both the nutrition category and food, natural products and foods in general. And, basically ran that company from the kind of the mid 80s and sold it in 2000. And at that point, we were the largest health food distribution company in Canada. We carried about 15,000 products.
Wow.
And basically sold to, every health food store, grocery chain, pharmacy chain. And then we also had a manufacturing company as well. We did, some of our own brands, but we also did a lot of private label manufacturing for other companies. So I kept the manufacturing side of the business and sold the distribution part. And, basically just, kind of continued on, in that manufacturing circles for several years, kind of bought and sold, built other brands and other companies. And, that's kind of where we landed today. So,
man, so it's been F2C itself has been around in its same form for about 17 years, right?
Yeah. So F2C, we basically had two brands. We had PhD Nutrition and we had F2C Nutrition. So F2C was our more of a private label Olympic branding. It's what we used for, pro sporting teams, the Olympic teams, not really a retail. It was more of a very simple, almost white label pharmaceutical. And PhD was our more retail style branding. PhD had been around, 17 years, in retail, predominantly starting in Europe. And then, as we, I had non-competes in certain markets, so I couldn't, do business in North America at the time. So it was started in Europe originally. And then we sold the PhD branding. PhD as a brand was really more bodybuilding driven. It was really more of that kind of weightlifting, CrossFit, a little bit of endurance, but, that really wasn't necessarily the focus at that point. So as we sold the PhD branding, we kept all the patents, all the clinical trials, all of the kind of the intellectual property and really data that we had built over the 17 years was under the F2C. It was just PhD was kind of retail. So we basically separated the two, sold PhD, and then we decided to bring F2C, out in commercial retail. I guess probably been, 18 months ago, 24 months ago. So it's still fairly recent that F2C has really come on to the market. And
Wow. So I know so many pros like Michelle Vesterby, Nathan Killam that I've had on the show. They all use your product, and it seems like the quality of your product is above most of the things that come out of America. And I personally think it's because the FDA in America is just crap, but that's my opinion. I don't like it. I think it's just ludicrous, but that's my opinion, no one else's. But how do you manage the quality in Canada? I know there's a lot of testing that goes on in Canada to get things on the market up there opposed to America. What is this like?
Yeah, it's completely different. In Canada, things are completely monitored by the government. So Health Canada, supplement manufacturing. We actually have a third category, which is Canada's almost the benchmark I would say for the world. And, a lot of countries are kind of following what Canada has done. But, in most countries, and the U.S., certainly being one, things are either a drug, a pharmaceutical, or they're a food. And there's really there's no other category. And that's like that in most countries around the world. What Canada did, it's been probably 7 or 8 years ago now, at least, they basically made a third category. So they've got a drug product, like your Lipitor or your regular pharmaceuticals. Then you've got regular food. And then in the middle they call it an NHP or a natural health product. And so they kind of built that third category, which allows, much more testing, a much more focused attention to the products, because they're not necessarily pharmaceuticals, but they're not food, where there's really no support. So I think that addition of that third category is really kind of a benchmark that I think a lot of countries are watching and following. And it's made a huge difference, because everything is monitored like a pharmaceutical. Everything has to be, when you build a product, it has to be built to specific specifications. We call it, dusting over the vat, basically. You see a lot of brands, you look at their ingredients and they have, 85 products on their label, 85 ingredients. But that, there's nothing in there. It's just label claim. It's like they took the bag and shook it over top of the mixing drum. There's not enough of a lot of the ingredients to actually make any medicinal benefit. Where in Canada, when you build a product like a natural health product, every ingredient has to be in there for a reason. So if you're building, an electrolyte product, you've got to show clinical data why you put sodium in there, why you've got magnesium, why you've got potassium, and you can't add other things that just might punch up your label, the things that make, label claim exciting, like you see in so many markets. If it's not there for an actual documented scientific reason, you can't put it in the product. And you've also got to put it in there at the minimum medicinal dosage. So when you're making and building a product and you say, hey, I'm going to put sodium in this electrolyte, you can't just put a milligram in there and call it an electrolyte. They realize that that's not the medicinal benefit. There's no value to that. It has to be in there at least the minimum medicinal value. So that's part of it, so it eliminates a lot of the fluffiness on labels with, lots of ingredients and no real benefit to it.
So
and
basically you're saying that you can't just add fillers to your product.
Exactly. Everything has to be there for a reason, and you've got to document, and everything has to be there specifically for that. So if you're, like I said, if you're building an electrolyte, you've documented why you've put those ingredients in. You can't just put, bromelain in there as an ingredient. You might think it looks good on the label, but if you've got no scientific evidence to show that has any medicinal value to your product or to an electrolyte product that you're making a claim for, you can't put it in there. So it's forced companies to be a lot more, diligent on building their products, on building their labels, on how they're actually developing products. And then the part goes into testing. With part of the NHP guidelines, everything has to be tested. You've got to do physical, heavy metal testing, physical micro testing for, E. coli and different types of bacteria. You've got to do finished product testing. When the product is done and complete, you've got to test to make sure that, in that scoop of, electrodurance, it actually has, that 180 milligrams of elemental sodium per scoop. You've got to be able to show, true third party testing data to show that everything is right, that there is no heavy metals, there's no bacteria, and that all your label claims are correct. In the US and in a lot of other countries, you can build a product based purely on a C of A, a certificate of analysis that you got from a raw material manufacturer. So, when I buy, as an example, when I buy a sodium citrate, we would receive a C of A from the manufacturer of that actual citrate that says, trust me, this is, 90% pure sodium citrate, shows that there's no heavy metals, shows that there's no bacteria, basically gives you all the data. So that's available from, basically every raw material that you would buy would have a C of A attached to it. So in a lot of markets, you can completely build your product off of that piece of paper, not ever actually testing it yourself, but you could basically say, well, I trust this company from China that I bought this sodium from that says, trust me, there's no heavy metals. Trust me, it's actually sodium citrate. Trust me. And, unfortunately, we've learned, we don't trust anybody anymore. There's way too much fraud out there. So in many, many markets, people will build product purely based off of paper assays. They will calculate everything together. They'll pull together those 7 different raw ingredients, those 7 different C of A's, and basically go, well, based on the C of A, if this is truly 90% pure sodium citrate, if I put this amount in, this is what my label should read on the back end. And, based on this assay, they say there's no heavy metals and there's no bacteria, so we're going to trust them and believe that there is none in there. And, many, many products are in the market without actually never being tested physically at all. A really scary number is, we developed a system, probably 16 years ago, and it's basically a computer system that measures what a raw material is. So we have it's about a 2-foot long wand, basically, looks like a big clear stick. And as we get a raw material into our docks, we'll basically open it up, we'll insert this stick into it, and it does a DNA fingerprint, basically a study of what is in that actual barrel of white powder. And that matches it against a preloaded monograph of what, 90% pure sodium citrate should look like. And it basically does a DNA comparison to, what the monograph is as to what's in the barrel. Last year for our own products, we refused 42% of the raw material that came into our plant because it wasn't what it said it was on the C of A. Either the ingredient, we've had many that, it says that it's one ingredient and it's another ingredient completely. Typically it's, you're buying an expensive raw material and you end up with a filler. If you could just imagine, most raw material is white. It's a white powder that it starts with. So you could basically put anything in a barrel and, tell somebody that that's what it is. And, 42% of what we brought in wasn't what it said it was, or the bacteria count wasn't what it said it was, or the heavy metal wasn't what it said it was. But
wow, you just said, hey, I'm not putting that in my product.
Yeah, we return it. It gets refused.
Wow.
So, we test every raw material that comes into our plant, for the F2C brands. Everything is tested to match it against what we ordered against the monograph, and also matches it against, the C of A that the manufacturer supplies. Man. So then we go back to that manufacturer and go, hey, this is not what we ordered. This does not match. The reality, the scary thing is that, they're not going to throw it in the garbage. They're going to ship it to somebody that doesn't test.
Wow. So I know F2C is Informed Choice certified and NSF certified. Walk me through what both of these terms mean for you, a nutrition company.
And actually, we're kind of one step above that. We're actually Informed Sport certified. So there's basically a couple of different levels. So Informed Sport is the very highest level of the drug testing that's available. So with Informed Sport, and there really is only a handful of facilities, in North America that have Informed Sport certification, because it is very, very stringent. It's very hard to meet the actual Informed Sport because they actually audit your manufacturing plant. So they will actually come to our facility twice a year, and they'll basically do swabs throughout the facility. So they'll walk around, they'll swab all the different machinery. They'll swab the warehouse. They'll they swab the vents in the roof, and they basically test that for any banned substances. It's basically our plant is tested twice a year. That also goes to back up our testing. But then also with Informed Sport, every single batch is tested prior to release. So when we make a product, we do a lot of testing already. So, I'll just kind of run through the whole testing, but when we basically bring a raw material in, we do the initial test on our dock, or in our holding area to ensure that it is truly, sodium citrate as an example. Once it's passed that test, then we actually send it out for full heavy metals and full micros again. So first we want to make sure it actually is what they say it is, because there's no sense in testing it if it's not. So once we know that it truly is sodium citrate, then we test it to make sure there's no heavy metals or no bacteria. So that's kind of the first stage of testing. Then we basically blend the product. Once it's blended and is finished the blending, we actually send it back out for another micro testing.
So this is after you mix like some of your pharma greens, or you mix
after we mix those 27 different vegetables together and the formula is basically ready to go to packaging, we actually send it out and do another micro test again just to make sure. So it's re-microed again, which takes, about 7 days for every micro testing, because basically they take samples, and what they're trying to do is make it grow. They put it into a heated chambers, and they try to see if bacteria will grow, in those worst conditions. So it takes about 7 days of transferring plates back and forth.
They do the whole Petri dish thing is what I'm envisioning.
Exactly. Absolutely. So it takes 7 days before you basically get, your results of that micro testing. So once it's done the micro testing, then it goes into packaging. Once the product is all packaged and ready to go, finished product is done, samples are pulled from that. They are sent back to the lab again. We do another full micro and heavy metal, as well as a full assay to match the label claims. So they will actually look at it, like say the electrodurance, and say, the label claim says it's 180 milligrams of elemental sodium. So they will test to ensure that there is 180 milligrams of elemental sodium in the product. And then at that point, samples are also sent to the IOC labs and to Informed Sport for full product drug testing. So that all stays on our dock with big yellow ribbon around it, quarantine. Nothing can be sold until all of the testing has been sent back and everything has passed.
This seems like a lot of testing, and this probably costs a lot of money just to get this going, because by the way you make it seem is it's a 7-day tail before you can actually sell the products, even getting it off of your dock, much less getting it in the market to sell it. And then you have to hold that much product, and if anything fails, then you have to discard all that product.
Absolutely. That's why we do the extra testing, throughout different processes, to make sure nothing goes wrong, there's no possible way of anything going wrong with a product. Because, we've invested, there's a huge amount of money invested in quality control and just testing. And it's, you said it's 7 days for each micro testing at a minimum. So, just on micro alone, there's 21 days of micro testing, not counting, all the other tests that go along. When we get into banned substance testing, we've had times where it's taken, months to get drug testing through. We've had times where we've had finished products sitting on our dock in quarantine for months, waiting for release. But, when we do a manufacturing and when we send out the product, to Informed Sport, whenever you do a production for them, you have to include all your batch records. So you're sending them all the documentation to basically account for everything that's went into this product. So, when I send them, the batch reports, it shows that, we received, 500 kilos of sodium citrate, to make the product. We used, 460 kilos of sodium citrate in the product. Here's the other 40 kilos are sitting aside in quarantine. We basically document and we show the paper trail for every ingredient that goes into the product. And then you basically have to show your full batch record. So it'll show you that, you blended X amount of finished kilos of product. Then that went to packaging. you used X amount of labels. All of our labels are numbered. We have a number on the inside of the label. So it shows and documents every number. Every single label has to be accounted for. So, you did a production run of, say, 4,000 bottles, and you've got all the batch records that shows that you made 4,000 bottles, but you used, 4,020 labels. Where did those 20 labels go? Were they destroyed? You've got to document every label, what happened to it. It was wrinkled in production. It was folded over. It didn't pass QC. You've got to document and account for every single label that goes onto the products, just so they know that you didn't take that label and for some other reason it might have got onto another product, or it might have, went out on something that wasn't necessarily tested. Wow. So you've got to account for every bottle that you make and every label that you produced. So when we do a production, we're holding 4,000, as an example, 4,000 bottles of finished product on our dock. At any time, they can come in and audit those bottles to make sure that all 4,000 bottles are still sitting on our dock, that we did not sell anything that was not tested, that did not go through the banned substance-free testing. Man. So that's what makes Informed Sport different from all the other testing, even Informed Choice. Informed Choice, even though it's kind of the same sister company, it's it's a voluntary testing. They test one sample a year. It's a good assurance, it's a good example that, the chances are that it might not be tainted. But, for somebody that is a serious athlete, somebody that is specifically a drug tested athlete, most agencies won't take Informed Choice because, they could have produced 7 other batches that didn't get tested. They only tested that one batch a year. Right. So it just doesn't have that same criteria. They also don't inspect the facilities under those programs. It's only the Informed Sport that has the actual facility certifications. So
would you mind me asking how much it costs to even do Informed Sport certification?
Yeah, it's, basically every production, depending on how many flavors you're doing on a production run, but just on a single production run, you're looking at, upwards of $3,000 per production run just for testing, just the Informed Sport, not counting all the other testing. So the finished product testing, the one that's really expensive is the one that actually looks at all the ingredients in there to basically match your label claim. A multiple vitamin, you've got a multiple vitamin that has 50 ingredients in it. You could spend $20,000 just doing the testing on that product, just to match the label claim on the production.
Now, is this the same type of stuff that, like, I'm familiar with what happens in America, and I know you can have under a certain percentage of, say, anything in anything, and it doesn't have to be put on the label. Is that the same way here?
In Canada, no. Everything has to match. So there's a slight variance. You basically have a 4% variance of underage is what's legal in Canada.
What does that mean?
Say I'm making a claim, as an example, we're making a claim we've got 180 milligrams of sodium citrate in electrodurance per scoop. We could be, when they tested, we could be at 4% less than that. So whatever that comes out to, 170 milligrams or 172 milligrams.
Right.
We could be 4% or less and still be legal. The way that we build our product, though, is we build it based on overages. So we will build it, again, depending on the ingredient and depending on the expiry date of our product. And these are things that they're not required. These are just part of our, the SOPs that we've developed as a brand. But we basically build everything with an overage. So if it says, it's 180 milligrams, that's 180 milligrams at expiry date is the way we build ours. So we have to go forward and say, so we know that sodium citrate will depreciate at about 5% per year. So if we put a 3-year shelf life on it, we will build and make sure that there's between a 15 and a 20% overage in there. So where it says 180 milligrams, we would put, say, 210 milligrams in it. So we know that, the citrate depreciates at 5% a year. So at the end of 3 years, when the product is getting ready to expire, it will still meet its label claim. It'll still be a minimum of 180 milligrams.
Wow. So you're insuring it in the long run and all the way up to as soon as you buy it versus 3 years from now.
Exactly. So we're a lot of brands, and every market is a little bit different. Again, most countries, they're not testing anything anyways. There's no actual testing required. But, you know, as a paper rule of thumb, you know, if you could be in the US, you could be 10% under your label claim at day of manufacturing. So, you know, you could build a sodium citrate that, you know, your label says 180, you know, in true fact, it's sitting at, 160 or 162, and it's still legal. But really, by the time that product expires 3 years later, it's sitting down at probably 145, and It's still legal. It's just, you know, every company has different SOPs. That's the way that we built ours, to ensure that, you know, our label claims are valid at date of expiry, which is not something that's required. It's just something that we build.
Right. So to change gears a little bit here, I know F2C has quite a few different products. I've heard people talk about the Pharma Greens, the Electrodurance, the Hydrodurance, all of the different products here. Where would somebody start so that way they don't feel overwhelmed when they look at your website and look at all the products? Because there's a lot of different products on there, and some people might feel overwhelmed just by looking at it.
Yeah, you know, I think there's a lot of different philosophies. You know, one of the things that we really focus on as a brand is pH levels. And that's, I think, something that we believe is to be very, very important. So what I say to people, you know, if you're only going to start with one product, or if you've only got, you know, in your budget, you know, you only have $40 a month, you know, to spend on dietary supplements or nutrition, the biggest bang for your buck will be the Pharma Greens. You know,
really?
that is the staple of basically every athlete's. You know, you talked about the pros like Michelle and Nathan and, you know, Jen Annette. You know, that is the core to all of their nutrition programs is the Pharma Greens, and focusing on the alkalinity, making sure that their body is in an alkaline environment. You know, once it's in that alkaline state, you know, it'll actually improve the absorption rates of, you know, proteins, carbs, and electrolytes by, you know, up to 40%. So, you know, even if you're, you know, eating the way you normally do, you know, and not necessarily focusing, just by getting your body into that alkaline environment, you'll get a better absorption of the protein, you know, which will in turn will help your recovery. There's obviously better things you could do, and there's definitely different layers that you can build onto this. But, you know, really the core base product is our greens, and it's something that, you know, it's a patented product. It's a development, you know, it's a product that we patented the production method and the machine that actually builds the product about 10 years ago. So it's unique in the industry. There's nothing else like it out there. There's lots of other really great greens products that are great to take, you know, after your workout. You know, there's some really good products out there. But, you know, to actually create the pH conversion and to do what our product does, you know, it basically is unique and has to go through the method that we've developed. And, you know, we basically built a centrifugal extraction unit that basically separates out, you know, all the active lignans, flavonoids, vitamins, and minerals out of those 27 vegetables, and basically removes the fibers and the nitrates. You know, those are the ingredients that, you know, trigger insulin response in the body. And you know, we make gummy bears with those ingredients for kids. And what we do is we basically take those active compounds, and that's basically the base to Pharma Greens. That's why, you know, one little scoop of greens is the nutritional equivalent of between 6 and 7 full servings of vegetables, without the fibers and nitrates, without the sugars and the calories to create the insulin response. So we basically say, you know, as soon as your feet hit the floor in the morning, you know, 1 scoop of greens in water, nothing else to eat or drink, for 20 minutes.
So, all right, to play devil's advocate here, why would athletes really need this in the first place? Because most of the time athletes are eating what they need to eat, but you're saying they should do this as well.
Oh, absolutely. You know, athletes more than anybody else, really, you know, because athletes, you know, there's a lot of different advantages and benefits to alkalinity. You know, one, you know, as an endurance athlete, you know, you've got this huge amount of lactic acid that is dumping. You know, you're out for that. You know, most athletes are training, you know, if not every day, they're training, you know, 5 days a week. You know, they're either running, they're cycling, they're swimming. You know, during that process, you know, during the hormone process at night, you know, that's where the lactic acid that's still remaining in the body gets dumped. That's all acidic, you know, very, very acidic. You've also got a waste byproduct in muscle and tissue repairs that's also creates an acidic environment. So most athletes, you know, when they wake up in the morning, will be in an acidic environment. by getting that body alkaline and by working on the alkalinity, you improve the absorption rates of vitamins, minerals, proteins, carbs, and electrolytes. You reduce the output of the inflammatory cascade in your body because that's attached to pH levels. So recovery levels are dramatically improved. We saw clinical trials that we did a year or so ago for another patent that we're developing. In an alkaline environment, we saw up to a 60% increase in the rate of recovery in an alkaline environment over an acidic environment.
And these are like clinical studies to prove what's going on with the use of the product opposed to people that aren't using the product. And I'm assuming like this is like a scientific study.
They are. So we've developed a couple things, and again, been around for a while and been burned a few times. So we've developed our clinicals, and we've done, we do a number. We have a lot of clinicals. A lot of our clinicals were built around or built for patents to actually develop patents around our products. And then once that process is done, then we will go out and do, actual, clinicals that can be published, which are a little different criteria. But, we basically build them for patent purposes first. So we do clinicals from out of major universities. We use teams. We use race teams. We did a large-scale clinical in Europe about, 36 months ago for the electrolytes. We use 60 athletes over 26 weeks. That's what developed the patents, for our electrolyte blend. Now we're actually redoing that clinical in the next, over the next year or so that will be developed for publication. So it'll actually be built as a third party double blind that can be published, in the American Medical Journal.
Wow.
So, the challenge that we've had in the past, is we've built product, we've done clinical trials, but, we're not a huge company, in comparison to the big pharma companies. And, we've had a couple of times where we've developed products and then we've had them reverse engineered before we get our patents through, because we get our clinicals done, we publish them or we get data out there or the data is released. And then somebody with way more money, out patents us. And so we've been burned a couple of times over the years. So we've kind of, looked at it and went, our patents have to be the priority. And then, we'll work on, publishing the studies at that point.
Wow. So if pharma greens are the number one priority that athletes should get, what would be the number two product you would recommend?
Again, depending on what the athlete is doing, I would say, for the typical, Ironman athlete, or triathlete, probably glycodurance is probably, that is our main race fuel. Again, it's unique in the industry. It's covered under several patents. Both the hydrodurance and the glycodurance are kind of sister products that, came out of patents and clinicals that we did, 11 years ago, initially developed for burn victims and cancer patients.
Really?
Is where the initial technology came out. So, we do a protein product at this point, which is actually exactly the same protein you would get if you bought our PharmaPure Natural, the branded product off of our website. We also sell that exact product, exactly the same product as a medical product that's used in burn clinics for people that have been in fires or have been in burns.
Why would somebody that got burned need this?
Sorry?
Why would somebody that's been burned need this product?
Well, it's the amino acids that are in it, to basically rebuild skin, rebuild tissue. They need those focused, concentrated, clean amino acids that are found in that protein.
Okay. Now, based on just my experience with just my podcast, I've interviewed over 200 athletes and counting. And from what I understand, if somebody has 300 to 350 calories per hour they're on the bike, they're setting themselves up for a solid run day in a triathlon. And most of the time with people that use F2C, they're always at that 300 to 350 calorie range with the glycodurance. Is this by design?
It is, and I think that's one of the advantages of glyco. And what we found with, and working with a lot of our pros, they're typically able to increase the actual caloric intake that they bring in, typically between 30 and 50% higher than what they used in other brands or other products that are out there, just because of the digestibility of the product. What are the uniquenesses of the glycodurance is that it's a potato and rice-based carb, not a corn-based. So, probably 98 or 99% of the carb products in the industry are corn-based of some sort. They're either a glucose, a fructose, a maltodextrin. They're corn-based, which, obviously there's some allergens that are certainly attached to that. A lot of people have those kind of allergies, but also the molecular structure of the corn, the sugar content of that is dramatically higher. When you look at most carb products in the industry, in a 25 gram or 25 grams of carbohydrate serving, they're getting between 20 and 23 grams of sugar. Where our product, with the unique structure of it, it's, 25 grams of carbohydrates, but 0 grams of sugar. So there's no insulin spiking whatsoever with our product.
Man.
And then, the finished osmolality of the product. So the osmolality is
what does that mean? That went way over my head.
Yeah, so that's basically the osmolality of a product is the measurement of the solid particle of liquid. So water, just, standard water is typically about 170. The blood in our body is typically between 180 and 2 or 210. And then everything is rated from there. Most of the carb products in the industry, range somewhere between 550 and 700. Most of the gels in the industry range between 1,400 and 3,000. So that's basically the measurement of the size of the particle. Glycodurance comes in at 180. So we have the lowest osmolality of any product currently in the market, which basically dictates how fast that product will move from the gut to the intestine. So what they call gut emptying time. So the smaller the particle, the faster the gut emptying time, the less chance of GI issues.
Right. I've been following, so I read this book, I'm sure you're familiar with it, called The Pursuit of Endurance by Jennifer Farr Davis. She talks about the Appalachian Trail, and that got me interested in following the Vermont's Trail or Vermont's Toughest Trail, the PCT, the AT, and all these different trails. And when I started following that about the same time, Alyssa Godesky, I think I said that right. If I didn't, I'm sorry.
Alyssa Godesky, yeah.
Yeah, so she actually did the Vermont's Trail, and the entire time she was on the trail, she said on her Instagram that she used glycodurance the entire time.
She what she used was endurance 5-to-1. So
the
endurance, which is basically glycodurance. It's the exact glycodurance formula. So it has, the same carb base as glycodurance. It has the same electrolyte blend as glycodurance. It has the sustamine, which is the amino acid alanine and glutamine that basically increases the rate of hydration, which is kind of unique to our product. It includes that, but then it includes 1 part protein. So it uses a blend of a grass-fed whey protein isolate, whey concentrate, hydrolyzed whey, a pure micellular casein, and an organic cage-free egg white protein. So it has 1 part protein, then it added a little bit of organic coconut oil as a fat source to it. So it's just a way of increasing the caloric amount and then adding some protein to it. So on a race like Alyssa was doing, Endurance 5-to-1 is a great product for that. You're not working at necessarily that same aerobic threshold as you would in an Ironman event.
Right.
So, basically, and the longer distance, so Ultramans, the trail racing, that kind of idea, the 5-to-1 is a great product for that. In all reality, there's no, we've not found any true clinical data that shows any advantage of using protein in a shorter race, we call it shorter, but it's really not, but like a 70.3 or an Ironman. There's no real scientific advantage of inserting any protein. All that's going to happen is it could potentially create some GI issues because of the threshold that you're running at. Your engine is running so hot and so fast at that point. Where, an Ultraman or the trail run, those kind of things, you're not at that same threshold, so there isn't really that concern for digestion as much as you would. So what we do say for the 5-to-1 is that it's a great morning breakfast. So, that's kind of that ideal, that Ironman morning or that training morning, that gives you, 5-part carbohydrate to 1 part protein with a double dose of electrolytes and the sustamine to increase the hydration. You can build it. It's 125 calories per scoop. So you can basically build, a 350, 475, 600 calorie breakfast that's clean. There's no sugars in it. It's all carb, no sugar. It's basically carb, protein, and fat. And we use, the highest biologically available proteins that are grass-fed. So they are, it's a Canadian grass-fed whey protein.
Right. Because most Ironman athletes and even 70.3 athletes, the norm that I've seen is you wake up 3.5 hours prior, go use the bathroom first, and then you have breakfast. And you want to have breakfast exactly 3 hours before your race start time. And normally that's about 300 to 500 calories. And you're saying this would be perfect for race day.
It is. It's a great thing for race day, and you're not getting the sugar. People, it's strange when you talk to people what they eat for breakfast on a race day, and they're so concentrated on, when I get to that race, I'm going to do this, and I'm going to have this product that mixed at this ratio, and I'm going to count every calorie that I'm building. But yet, that race morning, they're grabbing, 2 bananas, they're grabbing bagels, they're putting peanut butter. I see what people eat and I go, my gosh, do you actually know how many calories you just consumed, or do you know how many grams of sugar you just consumed? And then you've got the whole digestion process. That's why you've got to start 3.5, hours before the race, because you've got to try to get it digested. The one advantage of using 5-to-1 and using a liquid breakfast is it is very rapid digestion. You can actually stay in bed probably, an hour if you can actually sleep, which most people can't. But, if you could actually sleep, you could probably stay in bed another, 90 minutes in the morning.
Really?
Because you're not having to really worry about the digestion. It's not that same issue. It's a liquid,
right?
Which is just absorbed, so much faster.
Right. I've interviewed. Go ahead.
No, I was going to say just absorbs so much faster than trying to deal with, the unknowns of food.
Right.
There's so many things, when you get into eating solids, and it's even like that on race day. I see people think that aid stations are buffets. It's free. Look at all the food in here. They eat all the stuff that they never eat on training rides, because they think it's a buffet. So, I'm not a fan of solids at all. I think it's been proven by many, many, many of athletes, liquid is the most efficient thing to use. It's absorbed the fastest and the less chance of creating GI issues. The act of chewing is what actually stimulates the release of digestive enzymes. You start to eat, Terry, you think I'm going to have a bagel, race morning kind of thing. I'm getting ready, that act of chewing, your body doesn't know what's coming. Your body goes, hey, Terry, you're going to feed me, that 25-ounce ribeye steak, so your body is shutting down the digestive system. It slows everything down, starts building up enzymes to bring in, this great steak you're going to feed me. And, you feed it a whole bunch of sugar. The body doesn't know until it gets there, but it starts to prepare, and, it starts slowing the digestive system down, preparing for food. And, that's really the last thing that, you really want to happen, either on race morning, prior to the race or during a race.
Right. I've been fortunate enough to interview quite a few pros, I think more than 50 by now. And one of the things that is kind of contrary to what we all, I've gotten a sense of, is they mostly want to get to the start line knowing that they're not hungry, but almost feeling hungry. Knowing that they're literally satisfied in their gut, but they're almost hungry. That's about the idea of where they want to get. And this seems like it would be a perfect ratio for that.
It is. It gets them what they need without all the extra fluff. There's not the fiber in there. People don't realize how much fiber is in a bagel. Again, something you don't necessarily want. Even it's not a huge amount, but fiber in the banana. Those are kind of the things that you don't necessarily want to be dealing with on race morning. The cleaner and the simpler that it is, the better off you're going to be.
Right. So I know y'all have athletes that need things that are vegan. What would you say? Vegan friendly, I guess that would be the right word. And y'all have a vegan protein as well.
We do. We do a really great vegan protein. So it's unlike a lot of the other vegan proteins in the market that are either very soy heavy. You know, we see a lot of brands, especially, you know, not necessarily as much here in North America, but in Europe especially. You know, soy protein is so prominent in the European markets and in some of the Asian markets. And, you know, we don't have soy in any of our products. We have removed soy from everything, even, you know, in the emulsifiers for our proteins, you know, where companies will use soy lecithin because it's an easy emulsifier. You know, we use sunflower seed lecithin in ours. So we are basically essentially soy free, you know, conventional soy free on our products. We do use a fermented soy in greens, but it's a completely different chemical structure to, you know, a standard soy protein or a soybean or soy lecithin.
And all of these products are tested to the Informed Sport choice or Informed Sport standard.
They are. So, well, here, I may explain that to you right now, because there is some changes that are happening at the moment in this. So our vegan protein is a blend of hemp, rice, pea, chia, and flax. So the main protein source in it is a hemp. It's a 60% hemp protein. And we use about almost 60% of our formula is with that organic hemp. Then we use a fermented organic brown rice as the second protein. Pea protein is the third one. So we use less than 12% pea protein in our formula. Most of the brands, you know, I'm not going to say any names out there, but, you know, a lot of the conventional vegan protein brands are, you know, upwards of 98 to 99% pea protein.
Really?
Because pea is the cheapest protein. It's the most commercially available as far as the vegan protein goes. It mixes very easily. But for most cases, it's cheap. And it's also missing 2 amino acids, which is kind of the downside to pea. But it is conventionally, and it was really the first commercially available. So when you've got brands that have been around, you know, for 10 or 12 years in the marketplace, pea is what they used. And it's really hard to change your formula when it's been, you know, when you've got some of the top vegan brands that have been that way for a decade. It's hard to change now to something else. So we have, like I said, less than 12% pea in ours. And it's really much more of a balance. You know, when you look at all the 5 different plants, because we use, you know, 5 different plant-based products, it allows us to actually almost manipulate the amino acid profile. So, you know, as a finished protein, you know, our vegan is actually probably nutritionally is one of the best proteins in the market. It's probably nutritionally better than our whey protein because, you know, whey is what it is. You know, you can't change the amino acids. You know, it's a whey-based protein. So, you know, we don't spike our aminos with anything. We don't put free-form aminos in anything. But with our vegan, you know, because it's 5 different plants and each plant has a different amino acid structure, we can formulate it so that we get the best of each of the amino acids. Wow. So, you know, on a rounded scale, it's probably the best. The only downside, or I guess the one we call it a downside, is hemp protein is not at this point, and it's just in the process of changing, but it is not approved as by the Olympic Association.
So is it banned? So is that what you're saying?
It's not banned, but it's not approved. So it's a gray area. So what we do, though, is we actually do all the drug testing on it. So we do the exact same drug panel that we would do on all of our other products, but we don't get the stamp. So we can't put an Informed Sport stamp on it. But anybody that wants to actually see the third-party Informed Sport certification for it, so we supply that to Olympic teams or to, you know, we supply, you know, pro MSM, you know, what is it? The soccer organizations here, you know, the MSL, not MSL, Major League Soccer, MLS soccer. You know, we have a number of teams that, you know, use our products. We actually provide the C of A's or the actual testing, Informed Sport testing results to them so that they know that their athletes are getting, you know, a clean product, that it's not necessarily approved, it's not necessarily banned, but we know that it has no banned substances in it.
Right. You're doing your best on your end to make sure that it's clean when they get it.
Exactly. So we actually provide that to anybody that wants to see a copy, you know, of the actual test results. We make that available for anybody that needs it or wants it.
Okay. So being that we're on the topic of banned substances and all that, What is it like being a nutrition company with all of the cheating in the sport that's come out over the past few years? Have y'all been under any more scrutiny? Have y'all taken any more extra measures? What has this been like?
Well, I think it's, that's one of the reasons why we went to the level of being banned substance free, by doing the testing. Really when you look at it, and again, I'm not gonna sit here and name names because, nothing's worse than lawsuits from other companies. But, most of the brands in this industry, do zero, absolutely no drug testing. Some of the biggest brands, you could think of, I'm sure you could think, Terry,
Right.
who we see at every Ironman race,
Right.
none of those are drug tested. None of them are informed sport, NSF, or any testing. They do zero banned substance free testing. They look, they're all about margin and profit, and, they don't want to invest, the cost. And, maybe something will never go wrong, but maybe it will. So, we're just making sure that, the stuff that, you guys get from us, we just know that it never will.
Right. I've joked with some previous people that I've interviewed, and offline we kind of talk about some of the dynamics of sport in general, because I always open up after every interview of, hey, what do you want to know about what I've learned on the way, or what kind of opinions would you like me to elaborate on that I've learned, whatever. And one of the things that always comes back to is how many age groupers are really cheating. And
Oof.
I've really thought, what would actually happen if Ironman or any real race said, hey, we're going to raise the race of the entry fee by $50 to $100 for some random race. Nobody's really going to bat an eye at their rate of going up by $50 or even $100 for the entire race. No real big deal. But with that, they actually pay for 8-foot tall fences, extra security, and everybody that does the race has to be drug tested at the finish line. And everybody is held to the same exact standard as a pro. If you deny the test, same standard as a pro. Hey, you're banned for 2 years if you deny the test, just like guilty. Like, I wonder how many age groupers would really be caught doping. Like, it's been something that's been really talked about a lot recently.
It's probably a scary number. It's probably a number that would horrify most of the people listening. I was at an Ironman, a 70.3 race, near the end of last season. And I was, standing there talking to, the race director. And, there's definitely people out there, there are people, there are groups of people out there that are taking this very seriously and are really, trying to drive this whole, the whole drugs and age grouper thing through. And, these couple people came to the race director as I was standing there talking to him, and they handed him a list of 30 people that were racing this particular race. And it was just an age group race. There was no pros at this particular race. Handed him a list of 30 people that they felt were doping, based on, other races, other ITU races or other sanctioned races that they had either walked away from or, failed tests or had, based on their numbers, that they had, very strong suspicions or had, so it's being talked about a lot.
Yeah.
I'd love to see more testing. I'd love to see even, moving it, start into that next level, where, you're doing random testing on age groupers. I think if they knew that they were going to get tested, or the chances are, and the problem is it just needs to become more readily available. The problem now is cost.
Right.
And things are getting better. Testing is becoming cheaper and cheaper, and it's becoming more and more available. And I think, but unfortunately, so are ways of duping, drug tests. Those are coming up as fast as, ways of testing. So
right. One of the things
I'm sure the numbers are a lot higher. I'm sure the numbers, even in the pro ranks are there,
Very true. I was talking with one athlete recently, he hasn't been on the show, but we were talking about a potential solution just to have available would what would happen if, hey, for an extra fee at the finish line, you could stay in the finish chute, and then you would literally have someone come and get you from the finish chute and take you directly to like a Bloodmobile, like a mobile Bloodmobile. They would draw your blood and then test you for an additional fee. And that way, if anybody ever questions you and your integrity, you can say, hey, I paid the extra fee. Here's my results from that drug test at the end of the race. Like, here it is. Like, even if that was available.
I'm certified drug free.
Yeah.
That would be awesome.
Hey, here it is, you know. And if they offer that at every single event, like that way athletes can say, hey, look, I here's my splits, here's my drug test. Like, I'm good. Like, I know there's a few teams that would say, hey, you have to do that at every race. Like, you have to pay that extra fee at every race to get drug tested. And the people that are on those teams would probably do it because they know the name of the team is that well known, you know?
Well, and that's, you know, for us, that's one of the things that we've stepped up this year. You know, we've sponsored and we've been on course at a lot of races, you know, over the last, you know, well, as F2C for the last 2 years, but, you know, as PhD for the 3 or 4 years previous to that. And we've worked with a lot of races where we've been just one part of a race, where we've been, say, the recovery partner or the electrolyte partner or, you know, the on-course carb product. You know, we basically now have, you know, sat down this year and said, you know, listen, as a brand, unless the other companies that are going to co-share that, you know, so there may be 2 of us or 3 of us that are nutrition sponsors for that race. Unless everybody is banned substance free certified, we won't do a race that we're going to be attached to somebody else. Because, you know, as a brand, you know, we're doing the testing. You know, we know that our stuff is clean, but, you know, when you've got so many brands that aren't testing, you know, should something go wrong, you know, with the days of social media, you know, we'd be hung out to dry before we even knew what happened. So, you know, we've basically said, you know, no more co-sharing.
Right. And that's one thing that I have to really give y'all credit for, because I haven't heard of any athlete out there that's used y'all's product that has gotten banned for substance abuse.
Yeah, we've never had a failed test. And even as a brand, you know, with all the stuff that we've tested, you know, we've never had a failed test, even in QC, you know, on a product itself. But, you know, we test products, you know, we actually have, you know, in our facility, we have the full banned substance free screen. So, you know, we obviously test our own stuff to ensure that, you know, all of our raw materials are clean when they come in. But, you know, we could test other products. Wow. And, you know, we've seen, you know, again, not going to mention any brands, but, you know, we've definitely seen brands, you know, last season that, you know, that would have failed the drug test. You know, small amount, you know, maybe not enough that would have triggered a positive result in an athlete, but there were still traces there. And, you know, it's going to happen. You know, we've already seen it. You know, we've seen it in a lot of other categories and a lot of other, you know, major organizations where, you know, athletes have failed because of products, you know. It's going to have to be a wake up at some point. You know, one of these days, you know, the golden boy of Ironman is going to fail a drug test.
For something they used on course.
Because something he used on course, you know, and that's going to change, you know, it's going to change everything.
Right. So what about the overall, I lost my train of thought. Oh my gosh, it happens. I know what I was going to say. There was a pro athlete out of the Dallas area that consumed products that she bought from a triathlon store, and she got popped for doping. And she was able to prove that, hey, this is the product I was taking. Here's the open container. Here is a brand new container that I haven't opened. And they were able to test her, and they still gave her a ban anyways. But it was a lesser offense. Would you recommend people that don't use your product to keep a closed container of what they buy as well?
Absolutely. That's something that we've actually done with our pros this year, and with mostly our pros and our own ambassador athletes, because we can actually, you know, we can make those kind of requests. But basically, if they're, you know, I'll use our pros as an example. They have to give us a list of every dietary supplement that they're taking, whether it's anything that's not ours. We have to know what they're taking. And we've told them exactly the same thing. If you're taking something that is not banned substance free certified, you need to take a sample of that. You need to make sure you document all the batch numbers and lot records, and you need to hold a retained sample, 1 or 2 retained samples. If you're buying a multiple vitamin as an example, because again, we don't have at the moment a multivitamin in our lineup. It will likely come, soon, but at the moment we don't. So what I tell the athletes is, document it. Take a picture of the lot number, take a picture of the bottle, take a picture of the lot number and expiry on the side of the bottle, and take, 2 or 3 capsules, 5 capsules, throw it into a Ziploc bag, mark the bag, lot number, this multiple vitamin, this lot number, and throw it in a shoebox. So if something ever happens, at least you've got something to go back on and figure out, who was at fault. But, when there's the options out there now of having products that are drug tested, why would you use things that aren't?
Right.
If you're an athlete. So, and it comes down to, it's the athlete's responsibility. That's why they're still getting charged, or they're still having to face, the penalties, because ultimately it is the athlete's responsibility to make sure that they are not taking something that is tainted or, would fail a drug test. So.
Right. I was talking with an athlete that was at the Olympic Training Center, and he said that in every bathroom, in the locker rooms, there's a sign saying you are responsible for everything you put in your body, whether it's an IV, whether it's through the mouth, anything. You're responsible for all of it, and you own all of it.
Yep.
And I feel like that's ringing true, a lot more true here.
One of the other things that we tell, especially when we're working with our pros, that are the tested athletes, there's little things that we tell them. I say, listen, don't use table salt. Don't buy the big, 10-pound blue box of salt from Costco. Go buy, a pink Himalayan sea salt that's still in a rock. Try to get it in as much of the original state as you can, grind it yourself. Because, we actually tested, some table salts last year.
Really?
And we had 2 table salts that actually failed the drug test.
Really?
What's happening is, and it's just a general statement, people are looking for things that are cheap. They want to save money. They'll spend $15,000 on a bike, but, they're not willing to spend, the $7, to buy the good salt. They go, salt is salt, I'll buy the $4 salt because, why not? I'll save a few bucks. I could buy more bike parts. Right. The problem is that as an economy or as an environment here in North America, we want things cheap. So what happens with those kind of things is you end up going to areas, whether it's China as an example, that's where, certainly it's traced back to, several of the failed drug tests, were sodium-based products. Salt was the core root of it. What's happening is that they're packaging salt, and it's not like they're trying to do anything wrong. They're not trying to poison us. They're not trying to make us fail a drug test. But the fact is that, everybody wants it so cheap. They're packaging that salt on a line, 40,000 square foot warehouse, 6 feet over on the next table, they're packing in amphetamine. And it's airborne contaminants that are creating the issues. It's not necessarily that they're specifically trying to do anything wrong. It's just, you're not paying to have that packed, in a sterile room, in a dedicated facility. You're getting it packed, in a sweatshop, for lack of better words. Wow. And it's pure cross-contamination that's creating, a number of the issues. But it's cross-contamination, but then nobody's willing to spend the money to make sure that what they're getting is clean.
Wow.
That's why I tell our athletes,
there's a lot of different steps to it that I didn't really know about.
Yeah. So we tell our athletes, for salt especially, spend the few extra bucks, buy the pink Himalayan sea salt. Typically, It's not being packed in China. Typically it's being packed at the source, in India. The chances are much, much less that there's going to be something, packaged in that facility or on that table, the day before that's going to create a failed drug test for you, and just it's things like that, just again, it's like I said, it's buyer beware. There's, was it 2 years ago or 3 years ago, one of the major ITU, Olympic champions, failed a drug test. And, they determined that it was from a steak that he had the night before.
A steak?
Yep. It was meat, that had hormones in it. And, when they went back to the restaurant where he ate the night before, because he passed the drug test, a day earlier, 2 days earlier, and then he failed it, 2 days later. And, they determined that it was the meat that he ate, had hormones in it.
But could the amount of meat that he ingested give him an upper hand?
No, I don't think there was any performance benefit to it at all. But it was a failed test. And that's the problem with most of the testing. Most of the fails is not enough to actually give a performance advantage. But the fact is you failed. The fact is you had drugs in your system. We don't know, is that residual because you were on a cycle for the last 12 weeks, and you cycled off and you've been using, the ingredients and using the products to rid your body of the residuals of that? Or was it from a piece of meat you had the night before? The problem is, we don't know, or the governing associations don't know what actually, what the truth is. In this guy's case, they were fortunate, it was quick enough and early enough, and they were able to actually test meat from that restaurant and found the residual in that meat. And that's the only thing that saved, a huge potential scandal. And
right.
issues.
I mean, and that's like, it's like what would you call it? I guess it's like I can't think of the right word for it, but it's a mark on your career indefinitely. Like, oh, yeah, you're the cheater. Absolutely. Like, no company wants to work with you at that point because you're a cheater.
Exactly.
Unless you can say, hey, here's what exactly happened, if they're willing to even look at it. Because most of the time, they already have an idea. Well, no, you cheated. Like, you're not talking to them anymore.
Yep. And it's just, you don't know. Like I said, unless you can actually prove that. And ultimately, you are still responsible, for what goes in your body. That's why it blows my mind. Like I said, there's gonna, something will happen. It's at some point, we're going to have, a big disaster where, a whole pile of people are going to fail a drug test at a race somewhere. And it's going to come back to the race promoter, that brought in a brand, or served something on course. And, the lawsuits that are going to be associated with that are going to be ugly. Because, it's not like that product, a product doesn't have to, they're, ABC electrolyte that's served on course, unless they're actually saying, no, we're banned substance free. We test, and they didn't, and they failed. Then there's some definite liability. But, if they're not saying, hey, we're banned substance free, if they're not making those claims and they're not touting that, really they're not the ones that are going to be liable for it. It's going to be the race promoter that actually served that product. That's going to, I think, where the liability will fall out. So why a race promoter would even, work with a brand that's not tested is kind of beyond me at this point. But, it's
So I know there's other nutrition products out there that are like an all-in-one. Like, you don't need to have anything else. You can just drink all this. Can you really put too much in one bottle? Like, I know myself personally, I like to have a super bottle. Like, I use one bottle for the entire 70.3, and I'm good. Like, I drink ever so often, flush it with water, and I'm golden. I mean, but can you have too much in one bottle like some of the other companies do?
Well, I think, at least in my philosophy and the way that, we've done with our studies, it's keeping it simple is the best way of doing it. People, companies add label fluff, that really there's no scientific evidence. You see a lot of companies that will add, they add protein to their main race fuel, and they tout that as this is what you need for an Ironman. You need to insert this protein. Again, we don't see any real scientific data that shows any benefits to that. Same with amino acids. There's other brands that, they'll put amino acids into their gels or put amino acids in their race fuel. It makes a good label, it makes you think, holy cow, I got all this, look at all the stuff I'm getting in this product. That's got to be better. It's got more in it. It's got to be better.
So more is not always better.
More is not always better.
The quality that you have in there, and what you went back to is how osmotic, I think it is.
The osmolality, yeah, right. the particle size, yeah. You want to move it through, and the simpler that it is, the better off you're going to be. The simpler it is, the less chance of GI issues you're going to experience.
Wow.
We've had many, a lot of our pros, that work with us, and a lot of our athletes that work with us, probably a lot of people that you've talked to on your calls, they came to us because of GI issues, because they had used other products and they had continual GI issues. There was, one pro that, you mentioned earlier, every single race she would throw up. She knew it was a constant thing. She knew between, her was between kilometer, 7 and kilometer 13. She basically threw up at every Ironman race. That was just a fact of racing. Until she started using our product. And, she started with us last year. And, after the first race, she came back and said, I was waiting for it. Because I always get sick. I was waiting to be sick. And it never happened. She said, it's the first long course race that I've had that I can remember that I haven't thrown up. That used to just be a standard part of my racing.
And now it's not.
And it's not, and there's several pros that, that have that same thing. They just thought that was part of racing. I had one, a few years ago, one of the top guys, we ran into each other in the men's bathroom, and I'm coming down the stairs in the restaurant. It was after a race, and he's, talking to two people at the bottom of the stairs and, basically saying, I throw up every race. It's okay. I get it out of my system and I'm good, and it's just a fact of racing. And as we're standing in the bathroom and, I said, it's really not, we can make it so you don't actually throw up, we can show you how not to throw up. And, he's had some much better successes since that day.
Wow. So as far as just to kind of put everything together here, what would you like people to know about F2C that makes you really stand out and apart and above the other nutrition companies out there? Because, just in my 200 interviews, almost 50% of the people I've interviewed use F2C. That was overwhelming when I started looking at the numbers on that.
Well, I think probably the biggest thing that I could say out of that, and, and again, I'm not, please don't think that I'm putting anybody down, but, many of the nutrition companies out came from athletes that had GI issues or had issues with nutrition, and started building stuff, 10 years ago or 12 years ago, were building products in their mom's kitchen sink, trying to find a product that worked for them. And, they were at the right spot at the right time, and they were able to build a really good brand. But it came out of, I tried this and it worked, not out of a science. They don't have, the actual science behind their brands. And I think that's probably what makes us a little bit different. We are, like it says in our tagline, we're athlete focused, science driven. Everything that we do and everything that we put into our products is there for a reason. We don't put the fluff in there. We don't build stuff with, to build a label claim, just to make something look exciting on a label or sexy on a label. If it's not needed, we don't put it in there. Everything is there for a scientific medical reason. And I think that's really what makes us stand apart from the other brands is that, everything that we do is for a reason. Most of the other brands are, really are the same. There's not a heck of a lot of different other than, label and packaging. There's some really good brands out there. So I'm not saying they're all like that, but, a bunch of them are, they're just the same formulas with different labels on it. And, they don't really know why they do it. They just do it because, well, it works. And that's the way we built our product.
All right. And, one of the things you touched on a little bit was accessibility. I mean, I was fortunate enough to meet y'all down at Ironman Texas last year before I really even got my podcast really off the ground, honestly. I mean, it was just like an idea at the time, pretty much. And since then it's grown drastically. But I think the accessibility is almost next to none, because I think I've sent a few athletes over y'all's way, and Glenda would just hop on a phone call with them and explain what they need, where their downfalls with nutrition is, and just walk them through what's going on and really educate them with that.
And that's absolutely. And that's something that we're really trying to, and, we're trying to do more and more of. So you're going to see a lot more, things like we're doing today, and specific, trainings on our websites, over the next, 60 days, on specific parts of racing, pre-race nutrition, post-race nutrition, what do I do in the days leading up to a race? So, that's, it's about education. And that's, I guess, that's kind of what makes us a little different from some of the other companies. We're really more about the education, about the science, about, taking the time to explain, why you need to do something a certain way. And, I can walk through, somebody's nutrition, they, in most cases I can tell them, they tell me what they're taking, and I can tell them, what side effects they're experiencing, because, we see it all. And then we're able to explain to them how that actually happens, why they get, that bloated belly when they come off the bike. We see people all the time, they hop off the bike at the end of an Ironman, and, they look like they're 8 months pregnant. It's just a big bloated belly, and we can sit back and explain, and I can go backwards based on that bloated belly and pretty much tell them what they did, what they took, and almost kind of, repeat how their day went without them telling me anymore. I could tell them how they started their day, and I could pretty much tell them at what point, they threw up or had diarrhea.
Right. I mean, honestly, so
it's inevitable. So
yeah, some of the questions I ask before we even hop on the interview with most athletes I interview is, hey, what's your height, weight, how many calories per hour did you want to hit? How deep were the wheels? What kind of helmet do you use? I mean, I get all this information, and usually by the time I get to height, weight, calories per hour, I can already tell, because I already have their splits pulled down. I can really see how good of a day they had or how bad of a day they had.
Yeah.
And I'll never forget, I think it was Troy, episode 70, I think it was, with Ironman Boulder. His calories per hour was near 800 or 900. It was just astronomical. And Ironman Boulder last year was very hot, very dry, and he consumed a lot of calories on that bike. And he said he visited nearly all the porta potties on the run.
Yep.
I mean, and like, he didn't have to tell me that, but I assumed pretty easy what was going to go on.
Yep, absolutely. You could pretty much tell them exactly what will happen. So,
man. Well, Greg, I've enjoyed this. It's been great having you on. To kind of wrap up here, how can people reach out to you, follow F2C, get your products, or even follow y'all on Instagram?
Yeah, we're definitely, you can, it's our website, F2CNutrition.com. You can get on the website. You can order off the website. There's links off the website for all of our social media channels. So you can click right off of there going into our Facebook page. You could sign up, when you go onto the website for the first time, it'll have a sign up box where you can get into our regular newsletters. Facebook is obviously great. Any new products we do, which we're not going to talk about today, but we do have several new products coming out, over the next 60 days, kind of prior to the start of the race season. So, as those new products start to launch, which are, some very, very cool, kind of groundbreaking, industry-changing products, you'll be able to hear about that on Facebook and know when those things are coming out. So certainly reach out on our social media channels. Obviously, we're available at cycling stores. We're just kind of, again, rolling into retail sales. So, if you've got your favorite cycling tri-store that you're dealing with, and you want to get product directly at the store, product is available. Our distributor in North America is Holly Lambert Cycle, or HLC. So they're one of the largest, North American cycling and product distributors. So basically pretty much every retail store in North America will deal with HLC. So,
wow.
Well, or they could definitely order off the website as well.
Nice. And you ship to America and Canada. Where else do you ship to?
Those are the two main ones right at the moment. We are opening up a warehouse in Europe and in the UK within the next 30 days. And Australia, New Zealand will be opened up, I would say probably in the next 45 to 60 days.
Wow.
And then, we do have distributors in other markets. So we have product in India, we have product in the Middle East, product going into Mexico very, very soon. Definitely, we are on more of a global scale. You can pretty much get us anywhere now.
Wow. Well, Greg, to kind of wrap up everything here, to kind of get a great opinion from you, why do you do what you do in the first place to support the sport?
And again, I was never a pro, wasn't a great Ironman athlete, but, I've done some triathlons, I've done some Ironmans. I like the industry, I think it's a great sport. It's got great people, unlike so many sports, I think this sport has, a lot of really great people involved in it. And it's fun, it's a great industry. And I think, we can make it better. I think, with, some of the things that we've developed, I think we can make people's life better. We can make their day better. We can make their performance better. We can make them feel better.
So what joy do you get out of being a solid nutrition company and the brains behind it all? What joy do you get out of it?
Well, it's talking to people. I get a lot of emails, people that I've talked to at events. Everybody's got their own philosophy. A lot of brands, there's some brands that, the owners, still come out to races. I don't do every race, obviously, because we're all over the world. But, last summer, I think last race season, I was at, over 50 races.
Wow.
I like being there. I like being able to talk to people. I like being accessible to people. And it's the response you get afterwards. You sit down with somebody, you talk to them about their nutrition, even standing at a trade show booth, and, you get that email, on the Monday or the Tuesday going, that was the best race I've ever had. Thanks so much for helping me. It's, even if they didn't buy my products, a lot of people won't change on race day, but, you could talk to them about what they need to do to change, or even little things that they can do and timing on things. And it's just, it's being able to help people is kind of what I get out of it. So
that's awesome. Well, Greg, thank you so much. I've enjoyed this, and I look forward to following your company in the future. It's been great, man.
I appreciate it, Terry. Thanks so much.
You're welcome. Have a good day, okay?
Thanks.
Thanks for tuning in today. I hope you were able to learn something from today's episode. If you enjoyed the show, please take a minute to leave a review on iTunes or share it with a friend. Be sure to subscribe so you never miss an episode. If you'd like to see pictures from this athlete's race, learn more about who I am, what I'm doing, or be on the show yourself to share your story, check out my website at CoachTerryWilson.com. Until next time, continue the pursuit.